Coming to question 10 of previous year NEET question series 2025. So a patient in hospital was given IV fluids and he or she develops hyperchloremic metabolic acidosis. What fluid will cause this? So in one of our previous videos we were discussing ringer lactate. It has 130 milliequivalents of sodium, 109 milliequivalents of chloride, 4 milliequivalents of potassium, 1.5 milliequivalents of calcium, and 28 milliequivalents of lactate. This lactate is not an acid. When the liver is functioning normally, this lactate gets converted to bicarbonate, which is a base. So RL is a basic or an alkaline fluid. On the contrary, what happens with normal saline? So normal saline is actually 0.9% sodium chloride. It has 154 milliequivalents of sodium and 154 milliequivalents of chloride, which is not normal for the body. And what happens when you give such a large amount of chloride in the body? It leads to hyperchloremia, obviously. So if you are not able to decode this question, just by the word hyperchloremia, maybe you can say the answer in this case is normal saline. We'll just discuss the mechanism. So chloride and bicarbonate both are anions. So when one anion like chloride increases in the body, obviously the body will try to balance the electrolytes by reducing bicarbonate. So what does bicarbonate do? Bicarbonate enters cells. So on giving more amount of sodium chloride, high amount of chloride, to maintain osmotic balance, the excess bicarbonate enters cells. So what happens in the blood? Bicarbonate reduces. When bicarbonate reduces, we call it as bicarbonate is a base. So when base reduces, it leads to acidosis. So there is increased chloride. So it is called hyperchloremic acidosis, and this is a metabolic acidosis. When bicarb becomes low, we call it as metabolic acidosis. So the explanation is actually simple. So even if you are not able to understand, just remember normal saline has 154 milliequivalents of chloride, it leads to hyperchloremia. So NS is the answer. Okay. Last year's NEET was important because so many questions came on acid-base balance and so many questions came on fluids and electrolyte balance, since it is very important for practical basis. We'll just discuss some important crystallites. So we discussed about NS, we discussed about RL, and these two are the initial fluids of choice in practically any condition, especially diabetic ketoacidosis or hypotension. But one important distinguishing factor here is sodium Ringer's lactate is actually a basic solution. So it is preferred in conditions causing acidosis, whereas normal saline is basically an acidic solution. So it is preferred in conditions leading to alkalosis. One important clinical utility here is, we'll think of diarrhea. Intestinal fluid is rich in bicarbonate. So in diarrhea, more amount of bicarbonate is lost. When bicarbonate is lost, we call it as metabolic acidosis. Also we discussed diarrhea is one condition causing normal anion gap metabolic acidosis. So in diarrhea, what is preferred? Since diarrhea causes normal anion gap metabolic acidosis, always a basic solution or an alkaline solution is preferred, so RL is preferred. So the initial fluid of choice in diarrhea is RL. Whereas we will discuss vomiting. Vomiting is a upper GI symptom, that is fluid is lost from the stomach. Stomach, the main fluid is hydrochloric acid, that is it has more amount of chloride. So in vomiting, what is lost? Chloride is lost. And what is also lost? H+, that is acid is lost, proton is lost. When acid is lost from the body, it leads to metabolic alkalosis. So diarrhea causes normal anion gap metabolic acidosis, but vomiting causes loss of chloride and H+, so it causes hypochloremic metabolic alkalosis. So what is preferred here? A fluid which is actually acid. So NS is the best drug because it causes hyperchloremic metabolic acidosis, right? So in simple terms, in vomiting, H+ is lost, chloride is lost. Normal saline gives chloride, and when more amount of chloride is there, bicarbonate also enters the cell, so acid is regenerated, right? So these are the two common crystallites, and a few other one-liners. There is something called isolate G. G stands for glucose. So isolate G is a fluid which causes glucose, but actually isolate G is a gastric replacement solution. So anyone who has vomiting, it is better to give isolate G. So if you remember that isolate G is the gastric replacement fluid, obviously it has to contain more amount of chloride, right? So the highest amount of chloride is present in isolate G. Now coming to isolate M. M is called maintenance fluid. We already discussed NS, normal saline, contains only 154 milliequivalents of sodium and 154 milliequivalents of chloride, whereas ringer lactate contains sodium, potassium, chloride, calcium and lactate. Isolate M is even more expansive because it also has phosphate, it also has magnesium, and it has the highest potassium content in any fluid, which is 20 milliequivalents. Okay, it has the highest potassium content, and it is the M stands for maintenance fluid. M also stands for magnesium, and M also stands for maintenance fluid. It is the preferred solution in diarrhea, or basically whenever a person is not taking any intake, isolate M is the preferred maintenance solution. I think highest potassium amount may be the one-liner if it is asked. We have another fluid, isolate P. It is similar to isolate M. It is the pediatric maintenance solution. Coming to dextrose containing solution, we have 5% dextrose and 25% dextrose. These are called as hypotonic solutions. Because what happens is, when we give a dextrose containing fluid in the blood or plasma, the entire dextrose rapidly enters the surrounding cells. Okay, the glucose is entirely utilized by the surrounding cells. So what actually remains is plain water. So it actually dilutes the plasma. 5% dextrose or 25% dextrose, even though they are good drugs, good fluids for hypoglycemia management, when given in the blood, because the glucose enters into the cells, it actually leads to dilution or hypotonia. So these are called hypotonic solutions. Hypotonic solutions are not good for fluid, because when blood becomes hypotonic, what happens? Because of osmosis, the solvent leaves the plasma and enters the interstitial fluid. So it leads to reduced intravascular volume and hypotension. So giving dextrose containing solution, it is not good in hypotensive conditions. Even if it is not asked in NEET, it is very good for a practical approach. Never give 5% dextrose or 25% dextrose in a hypotension or in a shock. So since 5% dextrose has this complication, people combine 0.9% saline with 5% dextrose. It's called DNS. So it gives glucose as well as it prevents hypotonicity. Okay. So we discussed a few things about acid-base balance. We discussed few things about sodium fluids and electrolytes, because these questions were commonly asked. Thank you.